Hi guys, and welcome to our resting place. My name is Jamie, and today is a dementia support video. And today I am filming from my car because in lieu of the virus outbreak, it seems to be the quietest spot that I can find. Please ignore the passing cars. What matters is the information, really, rather than the setting. So today I want to talk a little bit about FTD, which is Frontal Temporal Dementia. Now, my loved one has this condition of frontal temporal dementia, FTD. And essentially, it's a dementia that affects the front part of the brain initially before spreading onto the other parts of the brain. And what we have at the front part of our brain is judgment, emotion, behavior, etc. So these are issues that come up quite a lot. And so I'm just going to run through some of the symptoms in terms of FTD in the hopes that making you aware of FTD, frontal temporal dementia, might help you if you have any concerns about a loved one that might be displaying similar symptoms. So FTD, I have a bunch of notes just down here off camera as well. So FTD is a loss of empathy. So that person can't relate to you or what you're saying in the same way. Socially inappropriate behavior. This can be by asking strangers for money or strangers for sweets or any resource. Just no idea of social conventions. In my particular circumstance, I found my loved one would always want to cut the queue and walk right in front of everyone else, right to the front of the queue, especially if we were in like Lidl's or Aldi's or Morrison's shops. It was always the case where my loved one would just like walk straight ahead of everyone else, and that became very tiring. Okay, the inability to concentrate or plan. So for me, I would find that my loved one would, and still to this day, can maybe focus on one task or one subject or topic for no more than a couple of minutes. It would be an achievement if they lasted 5 minutes on a particular topic or subject. They're constantly moving from one topic or subject to the next. Lack of inhibition. I found this more verbally with my loved one, so exclaiming that they need to go to the toilet in front of everyone or something of that nature, quite common. I know friends whose loved ones have the condition also talk about personal care and personal issues in public quite a lot. So lack of inhibition, from what I've seen, has been verbally really. Usually appears around the ages of 45 to 65. So within my loved one's family and siblings and whatnot, that seems to be about the right sort of age, really, for the symptoms to manifest. And what I thought they manifested as sort of depression or anxiety to begin with, I was completely wrong. So 45 to 65 age range, a little bit younger than most dementias, really. Repetitive or compulsive behaviors. Absolutely finding this with routine, but when I pick apart the reasoning for the repetitive and compulsive behavior, I realize that retaining short-term information is difficult, and so having to ask the same question over and over is a way of them feeling safe, is a way of them feeling heard and recognizing that. So it is very tiring when you have repetitive and compulsive behaviors, but it's most likely due to anxiety from my experience, even though it might not manifest as so. It's because of that short-term memory is not so good as it used to be. So repetitive compulsive behavior shows up in the way of the same subject over and over and over and over, like non-stop, like every couple of minutes for all day long, or needing to go to the same shop over and over to stock up on more goods over and over and over and over. It's definitely linked to short-term memory, and just that idea of familiar equals safe. At least that's how I'm rationalizing it myself. If there's any questions or comments or anything you'd like to contribute to this conversation, please let me know down below in the comments. Or speech difficulties. So I'm starting to notice speech difficulties a lot more with my loved one, finding the correct word, and will often mimic or echo what I am saying, because it's kind of easier that way. I've told my loved one that if they have trouble finding the word, we can guess the word together, or I can be a detective to try and find that word for her by breaking down what she's trying to describe, so we get there in the end. And often it's something familiar anyway. So like my loved one was trying to describe a bulb the other day, and ended up calling it a needle, ended up calling it a thread, a sewing kit. So I went about the process of trying to guess what she was saying, and I think after about 15 attempts I got there. It all depends how well you know your loved one, that you're able to interpret the lack of words for them, from my experience. So speech difficulties is another one. Problems with balance or movement. Not seen too much of this myself so far, and I'm about 5 years in. There's been a couple occasions where my loved one has fallen in unfamiliar places, down steps in city centres, or has stumbled down a couple of steps in the house at Christmas time, and I have noticed that the walking has started to slow down a little bit. We're walking at a slower pace. The inability to concentrate or plan. This is one that I noticed early on, really, the inability to concentrate or plan. And any plans that you do make are subject to change due to impulsivity. Inability to concentrate or plan, I saw with, say, if we had a plan for the day with my loved one and something caught their eye, they'd immediately want to turn their attentions to doing that instead. So it became quite difficult. And on the flip side as well, if they've got their heart set on something like taking the bus somewhere, it's very difficult to renegotiate. I mean, it is possible to renegotiate, and you'll find yourself negotiating a lot with everything that you do, and sometimes having to tell white lies, which is fine. which is fine. Don't feel guilty for telling white lies if it keeps your loved one safe. Frequent abrupt mood changes. I haven't really seen too many frequent abrupt mood changes myself over the past 5 years. It's very much been go, 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 go in terms of behaviours. I haven't seen it too many highs or lows. Maybe if anything a little apathy at times. But apparently there are frequent abrupt mood changes which do happen in terms of regulating mood in the front part of the brain. FTD has no cure. It's like the way I visualize it, dementia's pretty much like little potholes in the brain, so that the messages that are passing to and from cells aren't connecting. So and once the nerve endings are damaged, they don't really recover. So I tend to look at it as little potholes in the brains, really. That's a visual image that I keep with me, really. Poor judgment. Yeah, absolutely. Impulsivity. It's almost, I hate to say it, but it's almost like reverting back to childhood a little bit in some senses, where the sense of danger isn't there the same way that so for me and my loved one, they would spend time with people in the community that normally without this condition they wouldn't have even considered spending time with, and people with track record of creating difficulties within the community. So poor judgment is definitely a thing as well. So just to recap quickly, FTD is frontotemporal dementia. It embodies a loss of empathy, socially inappropriate behavior, inability to concentrate or plan, lack of inhibition, usually appears around the ages of 45 to 65, repetitive compulsive behavior, speech difficulties, problems with balance or movement, inability to concentrate or plan, frequent abrupt mood changes. FTD has no cure and also includes poor judgment. So if you're concerned that your loved one might be displaying some of these behaviors, especially when it comes to, say, finances or social interaction, consider going to see your doctor about a memory test and further testing for your own peace of mind. It's easily confused for anxiety and depression. At least it was for me to begin with. Okay, that's all I'm going to talk about today. Frontal temporal dementia. Thanks for stopping by. If this video has brought you any value, consider hitting the like button, the subscription button, notification bell, and of course I will see you in the next video. You take care of yourselves and the important people in your life. Bye bye now.